The saying goes that slow and steady wins the race, but when it comes to the country's COVID-19 vaccination drive, many would agree that a faster pace would be best. The second phase of the vaccine rollout began this morning, targeting the elderly, with only a fraction of the more than 3,000 planned vaccination sites actually operating this morning. It was another slow start. Well, let's get some views now, some reaction with Dr. Angelique Coetzee, chairperson of the South African Medical Association. Dr. Coetzee, good afternoon. Welcome to the Midday View. Just your initial reaction to how it has all begun. I've just crossed to two centres now with two of our reporters, Heidi Jokos and Aisha Ismail, in different parts of the country. Things seemingly smooth, but of course we know there's not a lot of vaccines that are available, and as we know, many elderly people have not been able to register and they're still waiting for that SMS.
Good afternoon, and a good afternoon to all your viewers out there. Yes, it is true. More than 4,200 vaccines will be distributed today across 87 the vaccination sites, so you can do the maths yourself. There was said that around about 7,000 healthcare workers, 7,700 healthcare workers will also be vaccinated today. The question is, where are those people? It's less than it's not a lot of people that's been across the country being vaccinated. It is true that a lot of the elderly people are asking, when am I going to receive my invitation to come and do my vaccines? I think we need to step back a bit and just try to explain. Minister is saying this, but I don't think the message is getting out there. Currently, we only have the Pfizer vaccines to be able to distribute to the people. The reason is Johnson & Johnson, there's a problem with the FDA, and hopefully they will resolve it by today. It's been going on with a plant in the USA that also supplied some of the ground stuff to the Gabata or the PE site, where 1.1 million dosages is still waiting. So we need to get that approval. So for now, the only vaccine that we have is the Pfizer vaccine. The problem is Pfizer needs two vaccines before you are fully or have a lot of immunity as to try to keep you out of the hospital. If you then now look at the nearly 1 million dosages of Pfizer, it means that we can only vaccinate around about 500 people at this,
500,000. 500,000 people. Okay. So
yeah.
Just on that score, the J&J issue is still being sorted, and hopefully you say it should be resolved this week. But when it comes to Pfizer, and because you said earlier that it looks like certain messages from the minister are not getting through, I think it's important to understand, even for the elder, that this Pfizer vaccine, you need a double dose for you to be safe.
Yeah, it's true. But now the problem is, if we give a double dose 21 days later, it means we can only vaccinate 500,000 people. And we are looking to see whether we can extend up to 42 days, so that hopefully by that time Johnson & Johnson vaccines will be available and the next batch of Pfizer would be coming into the country. So the jury is still out there. We still don't know whether we can extend up to 42 days. Yeah. Because if we can do that, it means we can at least for now vaccinate 1 million people.
And it's also good. It's also good that at least today phase 2 has started, and that the number of thousands of elderly people who will be getting their doses, 4,200, you said, that's available. So that's a good start.
Yeah, it's a good start, but it's a slow start.
Yes, indeed, slow start and not enough. Thank you very much, Dr. Angelique Coetzee there, for your views there. Yeah, it's a good start, but very slow and not enough. I mean, 4,200, and it's only one dose currently. The Pfizer, you need 2 doses. It's a very important message for you to have. If you have a gogo there, Mkulu, who's got the Pfizer vaccine today and they want to go back, don't say, no, you don't have to go back, you've got it. A Pfizer vaccine, he or she is going to have to go back for the second one when it's made available.